Welcome, listeners. As we continue discussing the medical conditions, in today's podcast, we will be discussing measles. You are with me, Livness Mchoga, the editor and the producer of this program. But I'm not alone. I am with Mr. Gift Josam, our usual guest. Mr. Josam, you are welcome.
Thank you for inviting me to this program.
All right. As we said that we'll be discussing measles today, Mr. Josam, can you tell us the overview of measles as a medical condition?
As you put it already, measles is indeed a medical condition. It has been troubling people in Malawi and in various countries worldwide. Condition. By using the data from WHO, that's World Health International, we've got 20 million cases annually being registered in the area of where the measles attacks. And we have got 145,700 individuals died with this condition. Endemically, it is 67 countries that has been facing these countries alongside Africa and other European countries as well as other continents. So measles for sure is an outbreak. When the country or every continent or every island encounter this kind of condition called endemic, has been encountered in that area only. But when it has been expanded to other sites as worldwide, it's when we call it pandemic. Generally, what we can say about measles is a viral infection. It's a viral infection that is caused by virus. There are a lot of viruses that causes measles. In overview, that's what we can say about measles.
All right. What are the clinical manifestations of this medical condition?
Clinical presentation of the case, it depends on one, immunocompetence of the individual, number one. Number two, antibody against. Again, that one can be the markers that are very likely to mark with the viral infection, that the virus that has been caused the measles. It will depend, it will again contribute to the clinical presentation. But the most obvious clinical presentation of measles shall entail the following. Patient will always exhibit fever. Fever shall mean that there is a reaction between the antibody and the virus that has entered in the body, and the metabolism changes and all reaction with other body system reacts. In such reaction, we expect the patient to have some fevers.
Okay.
Yes. In addition to that, the patient cough. Why the patient cough? The patient coughs because measles virus, it always attacks the lungs and specifically the larynx. So the patient always will have those kind of reflexes. So those reflexes will be deliberated or will be generated because the pharynx has been attacked. In addition to that, the patient may exhibit again runny nose. When we say runny nose, it's a matter of like a flu. The patient who always has got a flu will always have some secretion being discharged from the nose. So that is a natural response to exhibit or to make the exit of the measles viruses. Yeah, in addition to that, we always have the best marker for the measles is red eyes. The patient will always have red eyes, like in other condition, like the pink eye, whatever. However, the measles thing, we always have the red eyes. The red eyes because the sclera of the eye or the optic cell has been attacked by the virus. In so doing, it discharges some other things or it inflames. That inflammation resulting to nothing but the erosion of other epithelial cells, which will always exhibit the redness of the eye. In addition to that, there will be some rashes. Rashes can be generalized or can be patches or can be a bit scattered depending on the immunocompetent of the individual. But most of the time, these measles attack the kids starting from the age of 12 months up to 36 months. That means 1 to 3 years. It can go up to other years depending on the vaccination procedure. If the patient hasn't been vaccinated well, we expect the measles to attack you at any age. So those rashes will always attack the integumentary system. The integumentary system is just a skin, that's what we call. So it attacks the superficial and other top layers of the skin, then is the exhibit on the surface of the skin, and that's what we call the pink spots. Yes, so those pink spots are the key markers that we are likely to face when we are trying to scrutinize about the measles.
All right.
Yes, sometimes we can have some eye infection, like what? Otitis media. Why otitis media? Because, as you said already, that there is a red eye. So the eye and the nose are so proximal areas. Those proximity will result into nothing but there will be contamination of those viruses. In the end, the ear again will be attacked and it result into nothing but any eye infection can arise because of measles. Sometimes again, we may have some clinical presentation very, very close to pneumonia, or which pneumonia is a condition on its own. However, this pneumonia can again be exhibited in measles. Why? Because, as I said already, that the measles attack the lung, specifically on the pharynx. As such, we expect nothing but pneumonia.
Okay.
In addition to that, bronchitis. Bronchitis is a condition that most of the time they attacks the group age of starting from 6 months up to 36 months. So that's bronchitis. Bronchitis is different from asthma. Those are some of the markers that we see or we scrutinize to have differential diagnosis of measles. That's what I can say about the clinical presentation of measles.
All right. It seems that there are so many presentations of this disease, measles. Now, what are the causes? What are the causes of this? Okay, before going to the causes, what are the types of these measles?
Of course, measles, as you said, let's do vice versa. Let's tackle the types first. What causes measles, as I said, is a viral infection.
Yes.
In the overview, I said it's a viral infection and I explained about the epidemiological data depending on WHO.
Yes.
It's a viral infection, so measles is caused by virus.
All right.
There are a lot of viruses, and most of the time we talk about what we call the paramyxovirus, which is a serious one. So that is the family species that attacks us, individuals, which might result into measles. Okay. However, the genome of it is morbillivirus. So morbillivirus is the one that attacks the epithelial cells of the lung, specifically the pharynx, resulting into nothing but the individual might encounter the clinical presentation as I put it already. Okay. Of course, as you put it, that there are types of measles, very correct. Number one type of measles is nothing than classical measles. Classical measles is just a general measles. Number two types is modified measles, whereby in a modified measles, which is caused by the viruses, it can be morbillivirus or paramyxovirus as a family genome. However, there's other viruses that causes measles, depending on the study, and the study is still ongoing. So those measles, the modified measles, is the one that will exhibit the mild symptoms. When you say the mild symptoms, different patients behave differently. Yeah. Mild symptoms shall mean whereby the patient has got lesser clinical presentation. For example, the patient may exhibit fever, cough, and a runny nose. Those are the mild clinical presentation of mild measles. While atypical measles is the one that is caused by virus as well. However, the patient in this kind of scenario will exhibit severe symptoms. Severe symptoms shall entail what? Shall entail bronchitis, pneumonia, eye infection, rashes, and red eyes. Those are the severe symptoms, and those are the key markers that we deduce that we need to collect a specimen, and it should be analyzed to deduce that do we have the measles as an outbreak, or is it just a case one, or how are we doing it epidemiologically with an aim of helping the community not to spread the infection.
All right.
Yes. So that's how I can say about the types of measles. I said classic one, modified, as well as atypical. Sure.
All right. In case you're just joining us, listeners, in today's episode, we are discussing measles. You are with me, Livness, and Mr. Josam, our usual guest. Now, Mr. Josam, how are this disease transmitted?
Measles, as I said already, is a viral infection. So viral infection most of the time is an airborne transmission. We said on a clinical presentation of measles that the patient might exhibit coughing. When we always see coughing, that means most of the time that disease is airborne. So measles is one of the airborne conditions whereby it is transmitted by airborne. When you are very close to an individual who has got measles and coughed along you, and you sneeze or even swap those kind of aerosols, you are at risk of catching the measles. That's number one thing. Airborne transmission. Number two is direct contact with infected person. Direct contact how? Can be in a minibus, can be in a home, can be in the prison, can be in the cell of the police, can be in the beer hall, can be in a congested area at the ceremonies like the marriage ceremonies. Those kind of areas, you can be easily get measles where the individual having the measles is there. That's through direct contact. It can be, as again I said, the patient might have other things like the rashes. So those rashes, they might have some lesions. Yes. So those lesions, if they came out, the outcome there, it come contact with you, you can easily get. Yeah. If you touch them with your finger without knowing and put them in your mouth, then the virus will circulate in the system, attack the epithelial cells, pharynx, and you end up having the measles. Yes. Number three is contaminated surfaces. Contaminated surfaces, how? This comes because you can have the contaminated surfaces from other guys, from the family members, from the one who is infected with the measles, or in the hospital setup, maybe you are admitted, you have touched someone else without knowing, then you have taken it in the surface area. All those things might contribute to transmission of measles. Those are the three ways of how the measles can be transmitted.
All right. By saying how this disease can be transmitted, I think there are also complications. Isn't it, Mr. Josam?
Yeah, for sure.
Yes. What are the complications now?
Every disease might complicate or might not complicate it, depending on the immune capacity of individual. However, the measles always will reduce the immunity of individual and may complicate with the following conditions. Number one, pneumonia. It might complicate to pneumonia. Because I said this is a viral infection, but it attacks the lung. The lung is the one which produces or which helps in a lung gaseous exchange. So if the measles is not well treated, it might complicate to pneumonia. Why? Pneumonia is a condition whereby the alveoli of the lung, they are being attacked, and it behaves like the TB. However, they are different between pneumonia and TB. In so doing,